Here you go. Give me 1 second, get set up here. Doing a YouTube live video for the first time. Chris,
Oh,
great.
this is YouTube live.
Yeah,
Okay.
I'm going different. Let's mix it up.
Mix it up, right?
Let's go a little crazy.
Hmm.
Okay. Hello, Christy. Dr.
Hi.
again.
Nice to see you.
Welcome back to Orchid Spine Show. This is our first YouTube live video. Okay,
Wow.
Jesse's in the background, Javon too. What I want to talk about, I do a lot of reading about how to detect things, and we have to make sure we're doing enough things to stay healthy, right? How do we know what we don't know about our body if we don't feel pain, if we don't feel our liver or kidneys or heart or arteries or aorta or even diabetes too? How do we know that early? What we've done is looked at an ultrasound machine. The Sonoscape is the 5X?
Yeah.
The 5X, X5, sorry, I'm dyslexic sometimes. And what it is a machine that uses to test certain things. Let's walk through them real quick so
Okay.
you know, so we start the video. Carotid arteries, checking for those for atherosclerosis for 1, 2. What can that cause if you have carotid arteries, Christy? As I quiz you.
You're going to quiz me for that.
Yes. Strokes.
Other strokes, right?
Strokes.
Blood flow,
Carotid arteries right,
right
here.
Mm-hmm.
That goes to your vena cava to your head. It's called circulus. That's a full arteries in your head. Can cause aneurysms also.
Right.
If you're looking for those.
So we're looking at lack of blood flow.
That
Right.
to the head and also to the neck area too. That goes from the heart. Echocardiogram, heart conditions for 1, 2. Mitral valve prolapses in anywhere from adults to kids to elderly, especially kids too. We'll talk a little bit earlier about kids having spontaneous heart attacks or collapsing on the field for 1, 2 playing sports can happen. Thyroid. Well, how would it test the thyroid? What would the thyroid be tested for?
So in this, it's going to be scanned and looking for abnormalities.
Okay.
So it's giving you a look. If there is something found, then the next step would be contacting your doctor.
And thyroid might be a thyroid tumor.
Mm-hmm.
That can cause problems, causing
Yes,
hyperthyroidism
absolutely.
or hypothyroidism, causing hormonal issues in your body to become adjusted. Abdominal aorta, what would that cause?
I want to hear from you.
Good. Good answer. Oh, yeah. Same thing, if your abdominal aorta is calcified, can cause strokes, heart attacks for 1, 2, or can actually rupture. We can see it on x-ray sometimes also, become more expanded, distended, causing high blood pressure also.
Yeah.
So instead of waiting for high blood pressure to happen, get an ultrasound test here. At that point it shows exactly what's going on inside.
Yes.
If you're in vena cava too, same thing. Lower abdominal area around the lumbar spine. Same thing, checking for arteriosclerosis for 1, 2, and it's causing strokes. What would the pancreas be tested for? What would it be? Pancreas.
Masses.
Masses. Again, we're looking for tumors, looking for things that would cause abnormalities. Secondary.
Mm-hmm.
So if you have a tumor on your thyroid, on your pancreas, even on your gallbladder too, at that point, well, gallbladder would be different too, but pancreas or thyroid, then you would see the secondary problem would be abnormal hormonal levels, abnormal blood pressure issues too. So I detect the problem first before you have those issues and avoid that from happening. Gallbladder, I look at it more as causing gallstones, causing problems with that too, would cause
Yes.
digestional issues, problems with digestion, even breaking down fatty foods. Okay, how about ABI? You know a little about ABI. What's the ABI stand for?
The brachial index. So really that's looking at they're testing your ankle blood flow coming back up from your ankle.
Okay.
So when we're looking at
Check the
people with
baseline.
lack of blood flow, diabetes generally, lack of blood flow, right, to the feet, and we start seeing issues with the feet.
What kind of issues would we see?
Well, numbness.
Numbness?
Not getting the
Good.
circulation to our feet. So a lot of people that are dealing with diabetes have that they don't feel their feet. And then they're looking at amputations of toes and we want to avoid that. But just in general, as our society, we are sitting more and lack of blood flow is becoming the new smoking.
And that's the thing.
So we want to make sure, so having that test, it's very rare that you get that test.
Of course.
And so getting to measure your blood flow, down and back up is really important.
And a lot of it is too, like you mentioned too, early detection of type 2 diabetes.
Absolutely.
Things like that also too, that can be secondary. So by doing this, you can avoid getting your toes out there. I've seen some pictures of that, it's gross. Don't do that, people.
Yeah.
Avoid that completely.
Keep your toes.
Keep your toes. And again, and in a serious note too, seniors deal with this stuff all the time by getting tested in an office where you can do this before you have medical necessity issues. That's the biggest thing, so you avoid the long-term medication use and also return of your lifestyle, the importance of that so your body can feel better and get better.
Right.
How in the kidneys and spleen and liver too, I'm assuming also would use the actual look for tumors and masses. Again, it's affecting the secondary functions, where at that point it's kind of sometimes too late, where you may have to have kidney issues, kidney transplants, kidney removal, along with the spleen and liver too.
Yeah, so
for
you're
enlargement.
Good, good. What's that?
Enlargement. As
Enlargement of the liver or the
yeah.
kidneys?
Aorta, gallbladder, sludge in the gallbladder.
So even the size of the actual organ be affected too. We can see on the ultrasound as detection of an early condition for 1-2. How about glucose? What's glucose tested for?
Glucose is really important for seeing where our blood sugar levels are falling.
Okay.
And so we know elevated blood sugar is, sign of pre-diabetes, diabetes, and we're seeing younger and younger people with glucose issues.
Okay.
So, the more we can be aware of that and start taking care of that, along with being able to see where your glucose falls and then just look inside your body, how is my pancreas working? How's my liver working? Because we know diabetes is generally, a fatty liver is accompanied with that.
Good.
And we don't get a look at our liver. So this is really giving us an inside look of how our body's functioning. So for some people, it's really peace of mind. Wow, okay, everything's looking good inside. It's like a tune-up of your car.
Yes.
Right? We get our cars tuned up.
Well, we get our cars tuned up, and sometimes, as I'm a dad who has, I think I have at least 3 cars, actually 4 cars, I think, in my house. If I don't do the oil changes, if I don't do the normal maintenance stuff that I have to do, change the tires out before they become a problem, rotate them, I'm going to spend more money down the line changing out an engine. And doing things where it can be more effective. So I'd rather spend $30, $40 on an oil change or a transmission fluid or flush, whatever it is, versus $5,000, $6,000 on a new used car.
Yes, absolutely.
Something like that, right?
Yeah.
So with the human body, same thing. If we do things before we feel an issue, as preventive measure, because Jesse was saying too, the average publisher gets a screening like this and paid, because this is out of pocket. At that point, it's 55 and over. If we bring that to 45 and 35 and 25, get decided, no, hey, look, by doing your screenings now, you can avoid problems 5, 10 years from now.
Yeah.
Avoid taking medications and doing surgeries by doing things that are more proactive by screening yourself out first.
Yeah.
Why is that important?
Why is prevention important?
Yes.
So we want to
People that don't know that are watching YouTube.
right,
Live,
just in case, right? And
the
so
65
we want to
subscribers I have, whatever. Maybe 4 of them are watching if they're lucky.
yes,
Yes.
more the better, right?
Yes.
So, we want to, just like we were talking about with the car, we want to prevent a problem. So what the screenings are really allowing us to do is to get an inside look, because we really don't have an idea of what the inside of our body looks like. We can go by how we feel. We might be feeling great and then use the screening as a tool to just, reinforce, right? Okay,
Exactly.
I really am on check. Everything I'm doing seems to be in line. It's just a peace of mind. And then you might have somebody that might be dealing with some health issues, but when you go to your doctor, you don't get 12 screenings.
Why not?
I don't know, that's a good question, right?
Well, and a lot
Why
of
don't
it
we
is-
do this?
The reason I see, because I have people that come in here with shoulder injuries or back injuries that are beyond sometimes my scope, and I want to get an MRI done. I want to get an ultrasound done, a CT done. I want something, other testing done that they have to go to their doctor too. And at that point, a lot of it, well, they're not bad enough. There's no medical necessity yet required to require an MRI. The
Right.
reason is that I see it, and I've been told, is the cost is too high
Yeah,
relative to the benefit of the patient yet.
right.
Which really, for me, sucks, and I could use another word, but I don't want
Yeah.
YouTube to ban me again.
Want to keep this G-rated.
I don't want YouTube to ban me. A lot of it is what upsets me is that they wait till a problem becomes so severe. Now they need more medications. The original conditions has become worse. Now they need more care. Now they need more out-of-pocket expenses for them, even though they have insurance, because everyone has to pay out of pocket now.
Yeah.
At that point, why not avoid problems by doing things like this that gives people an idea, okay, I feel good, but am I really good? And things like this, and like I said, they don't do everything, but enough to give you an overall perspective. The main problems that have emergency type of care allows people to see that. So what you do when you're working out is eating well and thinking well and mindful movements with Christy's, at that point, you know that's helping you.
Yeah.
You know there's nothing underneath where I'm going for a run, but I check my life insurance policy because if I go for a run, it may not come home.
Yeah.
I may do a marathon or triathlon or CrossFit like this guy over here. At that point, I won't drop dead and realize, hey, I should have caught that earlier.
Right, and we see athletes that have, dropped out of a heart attack. And so this is really giving you a look. Once again, I have one of my clients that went and found that their daughter had something going on with their heart, and so now they're able to monitor it.
Wow.
So we're catching it at 13.
Wow.
Right?
Okay. Why did they go and get a screening first then? Or some screening done first?
To get a look, really wanting to be proactive
Did they have
and making sure.
other hereditary conditions before, or was it just to get checked?
Just to get checked.
Good.
Wanting to, both for the mom and the daughter, to know where things are, and, not that there was a health concern, just let me get it checked and see how I'm doing. And now, through the scan, they found out, okay, this is something that actually needs to be monitored. She might grow out of it.
Good.
But now we at least have this awareness.
And by doing that, and I don't know, Jesse may know more than me on this, by having the testing done and having a report by a certified ultrasound technician, sonographer,
Yeah.
at that point, can you take that to your doctor and go, hey, look, I had a test done by a certified sonographer. Can you prove medical necessity to get this other test done? Is that possible? Have people done that before?
Yeah, absolutely. They actually get the same day results
Okay.
with all of the abnormalities, whether it's cysts, nodules, masses, everything you guys just covered.
Sure.
And they take it straight to their doctor, their nutritionist, their chiropractor,
Okay.
you know, whatever they prefer
Yeah.
to how to take care of their health. And from that, they'll order additional studies.
So from there, actual show medical necessity, where the insurance company will cover that through the hospital or through
Correct.
their primary doctor.
Yes.
Hey, look, now you can do this. So it actually gives them an awareness. Hey, look, if I find something, I can use this and then use my health insurance, if that's a cost perspective, to get more testing done to make sure nothing else is going on.
Yeah, and I'm even wondering, can I ask you a question?
Possibly.
After time? Possibly. So
I don't know.
having
Sure.
that scan done
Yes.
and then coming to you, you know, being that chiropractic takes care of so much of our whole body,
Yes,
is that helpful to you?
yes. Because it lets
Yeah.
me know what it for me, it rules things out, especially coming in with acute problem, a severe lower back disc problem, severe nerve pain, problems where they've had headaches for a long, long time. I want to make sure it's always safe for the patient first. Before I treat someone with adjustments with chiropractic care, because it's a manipulation. We move the body, I unlock joints, I physically get in there and move things around. I want to make sure it's safe to do that. So having the carotid artery tested, if they're older, they've had heart problems before too, or have had surgery around the neck before too, I want to make sure it's safe for them. So by doing the testing, exactly, good question. Good job, Christy.
Yeah.
Good question. It allows me to understand I can be more aggressive with them, be more beneficial with them if that's what they need, so they
Yeah.
see the benefit of what I do.
Yeah, it's actually getting you testing that they might not get
Huge.
approved
Huge.
if they went to their doctor.
Or they may take them 3, 4, 5 weeks because now their disc pressure or their severity is about a 10, where they're in risk of having surgery
Yeah.
relative to doing something that's more natural for them to get recovered completely, versus having surgery. At that point, they may never get 100%.
Yeah.
So it avoids that overall condition by getting it done. Allows me to rule things out that I don't have to do testing with and wait for it. Because sometimes I'll see someone on a Monday. If I don't see them and treat them Monday, Tuesday, and Wednesday, that disc pressure increase and tear the disc, where they may need surgery by Thursday or Friday
Right.
when they come in that severe.
So timing is critical.
Huge. Timing is always critical. But having
Yeah.
things like this done allows me to see things in a very, okay, that's done, great, I can jump on it right now.
Yes.
I can be not aggressive, but I can treat it right now, not wait for more testing, or within 24 hours it can cause more of a medical emergency surgery, not just chiropractic relief that's possible.
Yeah.
Good
Wow.
question.
Yeah.
Good question. How about nutrition too? How would it affect someone's nutrition?
So, you know, for me as a health coach, I'm always looking at what are they putting in their body to fuel their body?
Yes.
You know, and looking at foods that are anti-inflammatory. So just doing a scan like this gives me an idea of what's going on in their body.
Got it.
And
Okay.
and so then how can we help support the body with healthy foods?
Good.
So I'm always looking at anti-inflammatory foods that are anti-inflammatory that are going to support the body.
Good.
So
And looking at someone's, say, for example, liver, spleen, even gallbladder too, if there's problems in that might be more acute, taking care of that first or during supplementation, I'm assuming in nutrition too, allows the body to actually absorb the material.
yes.
If you can't absorb it, it doesn't matter what you put in your body, it's not going
Right.
to actually be beneficial to you.
Right, so once again, it kind of speaks to going back to digestive health. So
Of
we've
course.
got to deal with the gut so that we're getting the nutrients. If we are experiencing leaky gut, we're not going to be absorbing the nutrients. If somebody's constipated, you know, they're not going to be absorbing the nutrients from their food. And so
Perfect.
it's the whole body, you know, we're not
course.
just looking, so even though it's giving us a scan of all the different organs, it's kind
course.
of giving us a check of how the body's operating.
Good.
But I'm looking at it as a whole, so what can we do to get everything working together?
And and it has to be the whole, it's called feedback loop. If the body's working internally, functioning well, at that point what we can do from the outside is allow things to function so we see the improvement. We see improvement in their overall health, nutrition, and energy too. How do you think it would affect someone's psychology if they're having anxiety or depression, or make them better to deal with that? How do you think that would happen?
With the scan?
With the
their scan?
As a scan too, okay, if they have a mass or distension from an artery or something like that, or even a disc problem too, a soft tissue injury or bone issue, how do you think that would affect them chemically or hormonally?
Right. So, I mean, if we've got things going on in our body,
Yes.
you know, we're probably dealing with inflammation. And that's going to, our energy level's gonna suffer. You know, who knows how it's affecting us hormonally.
What it would, in a
Right.
sense, where it would cause more stress to the body, so the stress hormones, cortisol,
Yes.
catecholamines, would actually
Yeah.
increase to keep our body under stress.
Right.
It doesn't have to be a joint or a bone issue or a trauma. It can be an actually internal chemical reaction to the body.
Absolutely. So when our stress level's up, anxiety so often accompanies that, but what we're finding is anxiety is a digestive issue. So the more that we have a picture of how the body's functioning, then we can be putting things into place to help build a healthy gut, to help build our digestive system that's helping to reduce stress and anxiety together.
So then the overall body can work from the inside out to actually keep the person healthy so they see the actual results. And again, going back to this testing too, I like it because it gets me the sense where, okay, it's a pre-screening to not only prevent problems someone's healthy, someone's having issues, how can I find out what's going on inside?
Yeah.
And again, and my biggest upsetness, if you want to call it that, is sometimes you need to be in severe conditions or emergency care to get this testing done with your health insurance or through a hospital too.
Yeah, and sometimes you're having conditions and you still don't get approved for the testing.
I've had someone now they have a problem in their back where it's not chiropractic related, but they won't approve the MRI or the CT because it's not medical, it's not bad enough yet.
So I really see having choices is really important.
Huge.
That we can make choices for, you know, this is our body.
Yes.
You know, I know the doctors want to make recommendations, but we need to realize that we actually have a choice, that this is our health, and we need to be proactive and really standing for our own health and finding the tools that we can to make sure that we get to feel good.
And having something like this available, and I'm going to put all of Jess's information, company information too, on there, allows people to an access to something they can use beyond when their health insurance says, no, we won't approve that. That's not medically necessary. They don't want to pay the cost for that too. $149 for this allows me to understand, okay, my body is good or not good, and rules things out that I may even have problems with yet, that I can avoid if there's a family history of it, or if I had problems in the past, or I'm a certain age where, hey, I have to get this thing checked, want to check with something that, for health insurance, for example, I have a high deductible, okay? I pay like $150 a month, probably for 10 years because my wife had some lipomas with little stuff going on for one too. That cost for that was 13 grand or something like that through the hospital. Because of that, I go, if I need something done, I'd rather get this done here for $150 basically. And like Jesse was saying earlier, some secondary insurances like Aflac, they'll pay between $60 and $135 toward a test like this because it helps them. Why do you think it would help a what is Aflac? Secondary health insurance, correct?
Yes.
Is that right?
Yes.
Why do you think they would pay for something like this?
Because they're looking to prevent,
Prevent what?
right? Prevent disease, you know.
Prevent disease, but economically though. Think of Aflac as a company, as a profit sharing company because they're stock shareholder company. Why do you think it would benefit them? Jesse?
Jesse.
Jesse?
That's a great question. I'm not sure. I think it would actually.
We might need to have you interview our Aflac.
We will
advisor.
eventually, but I'll give you the answer. I'll give you the answer right now. It saves them money in the long run. Okay, it saves them money in paying for a policy that requires surgeries. That someone's not going to be working for 90, maybe 6 months because they had surgery or complicated surgeries. They have to pay this person out now until they get back to work, until they actually can start making money again, so they can leave their house.
Yeah.
So that policy, they're saving money on the back end if someone gets tested, because there's not only it's a win-win. It's a win-win. The person understands what's going on. Their body either rules in or rules out health conditions, but also they're saving money because they don't have to pay for all these medical conditions that weren't caught, that now are emergency situations where they have aortic aneurysm, they have a stroke, they have stage 2 liver cancer, because stage 2, stage 3 liver cancer, that's when symptomatic. So the person wouldn't know I have liver cancer or liver tumor that can turn into a cancer until I start bleeding or having abdominal pain.
You
So
know
they're
what?
avoiding this.
As you're talking, and we're talking about prevention, and Aflac, and what's coming to me
Other
is how
companies,
cool
not
would
just
it be?
Aflac,
You know, I'm just throwing this out there that some businesses are looking for preventative tools, and so sometimes they'll pay, like if you get annual checkup.
Exactly.
You get a certain money back.
Exactly.
But how cool would it be to actually do this? Is actually much more effective than just an annual checkup. Right? You could actually get a look inside your body, and so insurances companies out there.
It would help all of it, right?
Yeah.
It would help everyone to see the benefit. I think in the long run, hopefully Jesse, and they will, but hopefully companies will understand this. I hear from companies, local companies here, they want to come in and have someone talk about nutrition and about exercise, about sitting right in a chair, which is good.
Yeah.
But they don't do it because they don't see the benefit of them, of the off work time. People have to go for doctor appointments, or they're off work for 2 or 3 months because they have a back injury now, from what I see, or nutrition wise too. Now they're diabetic or they have other problems too.
Yeah.
So they're having a healthy employee that can work and work with quality efficiency allows the business to prosper.
Yeah.
But you got to think more long term, not just short term.
Prevention, right? So screening like this, having somebody come in that can teach your employees how to move and keep their stress down and their circulation going.
Everything. And Jesse too, talk to me about with your company here and how it works. The sonographer, what's his background like? What's he? I mean, I want to know. Okay, why should I go with this company? If I want to go, if you want to get one done, great. If not, no big deal. But why this company? Why have you been successful? Talk about the machine too.
Yeah. So our competitors, which to go to any company that does a screening, is a positive thing. Okay. It doesn't matter which company. At least you're screening something and you're learning something about your body. But with our sonographers, we're just kind of a step up. Our sonographers, they have to be RDMS certified at a minimum.
What's that mean? I have no idea.
It's a sonography certification that you have to have. Very few sonographers actually carry 4 certifications that they're able to carry. Our sonographer carries all 4 certifications. He's kind of a unicorn. It's hard to find.
Nice.
They also have to have a minimum of 3 years clinical experience in hospitals or clinics, specifically finding pathology with echocardiogram and abdominal aorta experience.
Wow, okay.
So we have really high standards of our technicians. Ours happens to have 20 years experience.
Amazing.
And he's a teacher at the university level of sonography.
Wow.
Second, match that up with the technology, the machine behind you. That is the newest in mobile technology.
Great.
And it's very expensive, which the only reason we do that is so that we can actually give the best results to the patient.
And they see that benefit. So in my sense is, if I'm going to get it done, I'm going to pay out of pocket. I want the best quality by the best technician, because that has to match up. Without the technician being there, you can do a test, but if it's not done properly, you're not just taking a picture, you're actually doing things. This is why it has like all these probes and everything else too. So you see the connections here too. The problem allows things to actually see things inside the body. You want to make sure someone's doing it properly. If not, then you have a chance of either misdiagnosing it, having a false positive, and giving someone a lot of anxiety, they may have a problem.
Right.
Or, and then the confidence is lack of there too, where okay, if it didn't work the first time, can I still have a problem? And I don't know that.
Yeah. So can I speak to that
Sure,
for a
go ahead.
minute
Of course.
of anxiety?
Yeah.
So when Jesse had shared this with me, I'm really pretty skeptical about different medical procedures. And so when I went, and so my concern was, could this raise anxiety?
Okay.
By having a scan, could it actually raise anxiety?
Good to know.
And so when I went and did the scan for myself, I realized how kind everybody was, and the stenographer, just to even speak to him in his bedside manner, that you can ask him questions. Like I said, he can't treat or diagnose, but he can tell you what he's looking at. He was so calming that I felt like, wow, and everybody that I've talked to that's gone through it felt reassured about their health. Even if they found something, they felt really comfortable that they had a tool that would help them with their health. So I actually found that going through this process with this company, how they have it set up, is very assuring in giving you some tools for your health, whether everything just checks out fine, or there's something that they found, they felt really comfortable in how they were treated, and that it made them feel better. Good. And so for me, I'm always looking at reducing stress level. Right? Because we know digestive health is a lot of reducing stress to have a healthy body and a healthy gut. And so I felt that this actually provided that level of confidence and security and a reduction in stress, regardless of what the results were.
And this experience you just talked about and gave me a full image of, is relatives going to a hospital.
Yeah, your stress just goes.
You're like, okay, waiting in front, and sometimes the technician may have not the bedside manner, raising your anxiety.
Yes.
And go, I don't know what's going on.
And we want you to heal. Right?
Well, the biggest thing, Christy, is if they go, hey, you'll hear from the doctor in a couple days, and it takes a week or 2 weeks. So anxiety goes up as time progresses, and sometimes it's just on the doctor's desk, or the nurse received the fax a couple days ago too.
Yeah.
I have people come in here who've had mammograms done from the hospital,
Yeah.
and they're waiting for results. I say, you know what, I'm going to call them right now, have them fax results so you see the results.
Yeah.
9 to 10 times, as you know, it's going to be negative, so when I let them know. If it was a problem, they should call them right away, but not knowing, that factor alone will raise the anxiety.
Yeah.
So finding someone, like you said, has good, like you've done the test with them, you've
Yeah.
had the experience,
Yeah.
this is her talking, she did it.
Yep.
The bedside manner and his expertise and knowledge allows you to get a 99% chance, in my mind, of knowing what's going on right then.
Yeah, and they're giving you the results right then.
Perfect.
Yeah, and you can ask questions.
And
So-
when you had the test done, did you have to wait 2 hours? Did you have to wait 3 hours?
It really ran smoothly. That you come in, you sign in, you get your blood sugar done and your brachial ankle reading, and then you go over and get the scan. Now, if somebody was in front of you, you might wait a few minutes.
Sure.
But they keep it running.
20, 30 minutes, or how long did it take you?
You're really looking at about 30 minutes, maybe to 40 minutes.
Okay, based on some paperwork, whatever it might be.
Yeah.
So. And then right then, you get the results the next day, or when do you get the results?
Right there.
Wow.
Right there, you walk out with them.
Okay. Good.
Yeah.
Good. And again, like just was saying, so you can take that. If I have a condition here, you may have something going on. Go to your medical doctor. You can use that as medical necessity. Get the next test done.
Yeah.
To rule things up.
Yeah.
Good.
Yeah.
Anything else to add? This is I like these videos. As my wrap up is it gives you a screening tool to rule the things out. We talked about it earlier. That allows you to prevent the emergency situation. Okay, I've done interviews with people that do home health care. They come in after someone's had that before. If we can keep them less busy by keeping someone's health well, why not do that?
Yeah.
Jesse, anything else to add, Jesse?
2 fun quotes. I'll let one of you read them if you like.
You're great.
Oh, you want me to read it?
Great reader.
Let me put on my glasses.
Reader of words.
Okay.
Read the first. I'll read the second one.
Numerous studies have shown that early detection saves lives and increases treatment options. I mean, absolutely. You think about when you find out about something early, you have choices,
Easy.
right?
And who's that by?
That is by the American Cancer Society.
They're pretty popular, right?
Yeah.
I just want to make sure.
Yeah. Anybody heard of them?
Probably some people are in there. Then this year, 10 million Americans will suffer disease that could have been prevented by St. Joseph Hospital. And the biggest thing is that prevention. We're chiropractors. We're nutritional coaches. We talk about that all the time. When I see a patient, I want their back better, their neck better, the headaches gone, so they can get healthy by doing exercise and stretching, eating well, and thinking well. Yeah. And with what you do too, how do you promote that health?
How do I promote health?
How do you promote that once someone comes and see you so they stay healthy?
To stay healthy with regards to the scans, or just in general?
In general.
In general is making time for themselves. Creating those healthy habits that they know are going to give them the energy and the health that they want. Good. Sometimes we're so busy that we forget to take care of our own body.
Huge.
So it's getting people back and paying attention to their body and noticing what's going on. And then making those time to eat healthy food, time to get some exercise in there, time to see their chiropractor.
Well, spending the quality and efficient, I was listening to, I think, Air Radio today about Chiro's efficient time, not just time in general. And being effective with your time when you spend time on your health, as we do with our family and kids, and sometimes selfishly for ourselves. If we can do that and form those habits, so it becomes part of our lifestyle, daily, weekly, whatever it is. So you maintain that, and by doing, again, going back to the scan, this gives you the peace of mind that what you're doing for your health is effective.
Yes.
You still have to have life insurance and health insurance for emergency stuff, but can we be effective so we don't have emergency care? We become disabled, our quality of life decreases sometimes permanently.
Yeah, and what I love about creating healthy habits is incorporating that in with your family.
Huge.
Sometimes people think taking care of themselves takes away from their family, but what if you're doing it with your family?
Go for a walk the dog with the family.
Yeah,
Go
and
for
even
a hike
doing
with the
these
family.
scans, younger, having it for kids and teens also is a great option.
And we talked about earlier too with Jesse is kids, you hear in the news all the time. There's a kid over here in Rancho 3 years ago, and I'll talk to Eric about it. She was playing softball, and she just didn't feel good. She walked off I think the mound or was batting, and she had a heart attack and died.
Yeah.
Again, it's 1 out of say a million, but what happens to you in your neighborhood, you go, what the heck happened? So how do you prevent that? By doing things like this.
Yeah.
And again, with your events, do you charge for those things when you do events like that?
The free SCD events.
What's SCD stand for?
So sudden cardiac death.
Okay.
So we do kind of what's out of reach, which is the echocardiogram
okay.
and everything that involves the heart. And we still suggest they go get an EKG. EKGs are just much easier to get because they're at a lot of doctors' offices.
Got it.
But we do this part because it's much more expensive out of reach. They do not cost anything to the athletes.
So if you go to an event, for example, and I know we're going to set something up in the near future, locally around here, hopefully real soon, is what do you do? What do you require from them to do? They charge them $400 out of pocket to get it done at the field or at the event, or what do you normally do?
So we'll talk to the athletic directors at schools or the coaches, invite the students, student athletes out for free to do the echocardiogram. They do have to have a parent or guardian there to sign the waiver.
Of course.
And then we ask for a donation if they can or want to give a donation that we actually donate back to the community to help kids in their local community.
So you guys don't make money at all?
We make no money. We just pay the stenographer and the worker for the day, because if they're doing 20 events a month, they have to make a living, but 100% of it goes to the community.
And why do you do that?
We do it just to do it for the athletes.
Good. And you get the awareness out there too, right?
And we get the awareness.
And for not only the athletes, but also their parents, their grandparents, hey, this stuff does work.
Yes.
It is, in fact, gives you credibility. In my sense, gives you credibility. We're helping you guys out in the sense where, because we want people aware that there are private companies you can pay out of pocket at a minimal cost, very minimal cost, to get the same testing so you don't have problems in the future. Prevent things that could be emergency type of situations.
Yes.
Good, that's fantastic. We're trying to have some events here. I'm not going to go too crazy with it, possibly in our office in the future. But a lot of it is, I want my patients to understand you need to keep your body healthy. And by sometimes knowing what you don't know, by doing ultrasound testing like this too, you can get that benefit. So you know you're eating well. You know you're doing things that are healthy habits that keep you healthy in the long run. We all might get hit by a Mack truck, right? That can happen. But if it's not going to happen, how do we control our health we can control? Anything else to add, guys? Javon?
You know what? I want to add one more thing.
Go around.
Since we started talking about kids, that even doing the early detection for kids, 1 in 10 kids has a fatty liver under 10.
Wow.
It's not tested, and we're seeing more heart disease in kids. And so having that scan even done for kids to even if it was just checking their heart and their liver.
How to check for fatty liver? How to check for it?
So in the scan, they're scanning it and they're able to see the condition of the liver.
Wow, okay.
Right?
So by using that, what would you do when you use that, not to cut you up, but if you saw that, how would you treat that?
So we know that fatty liver is caused by too much sugar, fast food, processed food, right? And so for even maybe a teen starting to see, wow, there's actually something going here. Usually seeing is believing. Wow, maybe I should make some changes and start making some healthier choices. They have a choice.
It's an objective finding though, where okay, this is what you have,
right.
Deal with it. It's not me saying it, it's not you saying it, it's not mom and dad saying it, it's saying, hey, this is what the machine says. Do you want to live longer?
Yeah.
Do you want to not have health problems on the line?
Yeah.
Do you want to be normal?
Yeah, but we're literally saying, maybe we don't want to be, we want good health. I don't know about normal, but good health.
There's no normal.
But, we're seeing a lot of teens with issues that we didn't see until they were in their 50s. And so,
because of problems that are happening in their teens.
Because of fast food, processed food, sugar, the abundance of that, that it's so easy. And not all kids have that education on how to make healthy choices around food. So,
well, they're naive. They go to where their parents take them.
Yeah.
And I have McDonald's down the street, and they're 15 billion served this year or something, whatever it is.
Yeah.
It's amazing how parents, and get off the topic, how they don't guide their kids or put healthy foods in the fridge for them to eat versus the junk food. That's cheaper, but isn't really food at all.
And I think a lot of times people are doing the best they can, and they don't know what those other options
They're naive.
are. So we get to educate people about that.
Good.
Yeah.
Good. And by having this testing done, allows them to see, this is what you have now. How do we fix this? How do we change it so it doesn't affect you as you grow?
And health doesn't have to be hard.
No.
Right, and it can be fun.
It can be, as long as you, in my sense, give people better choices. And in today's society, we're actually making organic, healthy food cheaper.
Yes.
Because more people are wanting to eat it.
Yeah. Isn't that awesome?
It's great. It's not a rarity anymore.
Yeah.
Maybe it's just California. I don't know what it is. It's Southern California. Anything else to add, Jesse?
That's it.
Trevon?
No, you guys are amazing.
I don't know. We'll figure it out later. Next video, we'll figure out more stuff. We'll have more events coming up. I'll put their links inside the YouTube post. post other stuff too on probably Facebook too in a little bit. But realize your health is always up to you. By doing screenings like this, you see problems that you don't have yet that you can avoid. All right, anything else to add? Let us know, put comments. Subscribe to our video if you don't have it already. And we love your comments. At that point, we do more videos like this in the near future, and we'll see you soon. Hit the off button, Trevon. You're the man.
You're in charge of the camera.
All right.
Stop.
Somewhere.
I've never used Facebook.
Or just keep going.
Yeah, just keep going. I never used Facebook.
Playing games.
Done. Okay, easy. Done.